Hi, I'm Vanessa, and today I'm going to demonstrate on how to perform step-by-step an oral care for conscious client. Okay, first, what is oral hygiene? Oral hygiene cleaning the teeth and the oral cavity of the client. It includes the measures to prevent the spread of the disease from mouth and increase the comfort of the client. Purpose: to maintain the healthy state of the mouth, gums, and lips, to remove food particles from and between the teeth, to stimulate appetite, to provide sense of well-being, to remove dental plaque, to remove sores which results in ulceration, to maintain the intactness and health of the lips and oral cavity, to prevent oral infections, to clean and moisten the membranes of the mouth and the lips. Articles needed for dental oral care for our conscious patient: face towel, toothbrush, toothpaste, dental floss, mouthwash, petroleum jelly or Vaseline, and our kidney tray. Hi, today I'm going to show you how to apply a procedure for unconscious patient. Before we start, we need to wash our hands and wear a pair of gloves before we start the skill. And the first thing we need to do is to approach our client. Hi, Ma'am Martina. How are you today?
I'm fine.
I'm your caregiver, Vanessa, and today I am the one to perform you an oral test. Is that okay with you, ma'am?
Yeah.
Okay. And now let's start. Firstly, we give a sip of a small amount of water to. Oh no, we just put first the towel on her cheeks and then give a sip of a little water. Then I put a toothpaste and then start. Place the brush at a 45 angle to the front of the surface. Bristles must contact both lines of tooth and gums. Move brush in a small, jiggling circular, clean inside surface of the back teeth by moving the brush in a small amount. Clean the inside surface of the front lower teeth by tilting the brush vertically using small up and down strokes. Clean the inside surface front of the lower teeth by tilting the brush vertically using small up and down strokes. Move the brush for back and forth motion to clean the biting surface. Next, I will sip some water to clean up some dirt. Next, I will take a piece of dental floss that will be approximately 18 inches long. I will wind on my finger and I will floss in between two teeth, and I will move down, floss, shift, floss, shift, floss, shift. Then I will put in the other side. Next, I will offer a small amount of water to rinse mouth again. Then I will offer her mouthwash solution with 1/4 of mouthwash to 3/4 of water, and I will allow her to rinse her approximately 30 seconds. After the mouth is rinsed, I will use the corner of a towel as a pat face dry. I will offer her a lip balm
as long as she is not in oxygen. When the patient is in oxygen, we do not use petroleum-based lip balm as oxygen is convexible. I will then remove my supplies and remove the towel. How's that, Martina? Nice. Okay. Now I am going to clean up my supply. Take off my gloves. Wash hands. Record and report.
Hi, good afternoon. I'm Vanessa, and today's video, I'm going to show you. We are just finished on how to perform an oral care for an conscious patient, and now we perform a step-step procedure on how to give an oral care for unconscious patient or client. First, we need to prepare all the materials that we need to use before we give an oral care for an unconscious client. We have 3 oral swabs with warm water and the oral solutions, the MC tray, the lip balm, the paddle, and of course our gloves. So I'm finished to wash my hands, and now I am going to wear my gloves, medical gloves. Wash hands, apply gloves before this skill begin. I will always assume that my client always hear me, so I am always talk with her and let her know what is happening. Now I am with Martina in her position with pillow on her back. Okay, hi, I'm Vanessa. I'm here to do your oral care. I'm going to put the bed a little bit. I'm going to put things in position. I'm going to put towel under your face in case there is any drainage. We don't want to get any mess on your bed. Next I will take the kidney tray and place at near your chin and mouth to help collect anything that drips out of your mouth. I will start your oral care by using solution of 1/4 mouthwash and 1/4 mouthwash and 3/4 of water. I'll take the first oral swab and get it wet with mouthwash solution. I will use the oral swab to clean outside and upper teeth and inside of her upper cheeks, always making sure to keep the oral swabs in her mouth. Okay. Once I clean the outside of her teeth and cheeks, I will place the oral swab in the basin, and I will use a paddle bar, top blade to place between her teeth and help her mouth open if her mouth is not open. Then I'll take the next oral swab with mouthwash solution, and I use it to clean inside of her teeth and tongue and the root of the mouth. Okay, after the mouth is clean, I will use my last mouth swab and warm and whirl it around the entire mouth to help rinse the excess mouthwash off. Okay. Then I remove the basin and I use the towel to dry her face. The last step will be to apply her lip balm. As long as my client or my Tina is not in oxygen, we do not use petroleum-based lip balm as oxygen is invisible. Next, I will clean up my supplies. I will make sure that I will put the bed head back down to 30°C and place the light in each of my Tina. I will clean my supplies, take off my gloves, wash hands, record, and report.